Hello everyone, Jim Kim here again, and today we'll be talking about the musculoskeletal system video series. We're going to begin with the investigation of the upper limbs, and then we're going to talk about the lower limbs and other parts of the body and their muscles. There are a lot of muscles in our body, but we're going to go through the groups of muscles by location for each video so that you can have a more intuitive understanding of the main muscles that you may have already heard of, like the quadriceps femoris, your hamstring muscles, your rotator cuff muscles, and muscles like that. Again, if you enjoyed the content, please leave like, share, and subscribe to grow the channel. So let's get started. So here is a male model as usual, and removing the skin like this reveals that the bones are available to view, and we're going to focus on the bones of the upper limbs, which begins with the scapula as being highlighted here. And the scapula has this protrusion that's pointing towards you, and that's the scapular spine, which I'll be going over. And then the scapula itself seems like it's floating actually, because it's actually suspended in the body through its attachment to muscles. But it's attached to other bones like the clavicle and the humerus. And the humerus is the second bone of the upper limb that we'll be going over today. It has a head and a body, and the head and the body are joined by the neck of the humerus, as I'm highlighting here. The neck of humerus is also a common area in the humerus bone that gets fractured easily in old patients, like patients who fell on the bathroom floor. And when you perform an X ray imaging analysis, it actually shows a neck of humerus fracture often. More distally, the humerus is associated with the radius bone, as being highlighted here, and the ulna bone, as being highlighted here. And these two are quite long bones, and as you can see, the radius bone is actually on the thumb side of the upper limb, while the ulna bone is on the more pinky side. And another way to view the location of the radius, or to remember its location in the body, is that radius also synonymously refers to the lateral part of the body, or the lateral movement of a muscle, while ulna is more associated with the medial movement of the muscle, or towards the midline. Now back to the bones here again, and distally there are carpal bones to the radius and ulna bones, and the carpal bones then are attached distally to the metacarpals. Metacarpals are then attached to different phalanges, which make up the finger bones of the body and allow fine movement of the fingers. Now I want to go through the arterial structure of the upper limb. As usual, all blood begin in the heart. Then the blood get pumped into the brachiocephalic trunk, subclavian artery, axillary artery, and within the axillary arteries there are a lot of different arteries that we will not be going through, but I will be going over the main sub branch of the axillary artery. Then the axillary artery becomes the brachial artery, and the brachial artery is actually one of the pulse points that you measure during physical examination. So if you lay the skin over, you can actually see the pulse point for the brachial artery that you can actually feel and measure to check the blood pressure of a patient. You can then see that the brachial artery then divides into ulnar artery, which is associated with the ulna or the medial side of the forearm, and the radial artery, which is associated with the radial or the lateral part of the forearm. And the radial and the ulnar artery then eventually join together at the palm as the palmar arch arterial network. Now I want to discuss more about the nervous system of the upper limb. And it all begins with the brachial plexus. And the brachial plexus begin with the superior trunk, which is made up of the C5, C6 roots, the middle trunk made up of the C7 root, and the inferior trunk made up of the C8 and T1 root. Distally, as they divide more and more, they become this huge nervous structure called the brachial plexus, as being shown right here. It's very complicated, but we'll be focusing on the main nerves for this video. In fact, when we zoom in, it's very complicated, but I'm going to simplify to make it look like this. Now that looks a lot cleaner, and first we're going to discuss the median nerve, which comes from the brachial plexus. And the median nerve is also right above the ulnar nerve, which travels along the ulnar artery, and there's the musculoskeletal nerve, and here's the axillary nerve. And finally, here's the radial nerve that travels more inferior. And we're going to go over the muscles that these nerves innervate very soon. And you can see that these nerves extend distally, and these are pretty long nerves. And especially the median nerve can be seen traveling along the midline of the upper limb. And again, there's your radial nerve right there, and they extend all the way down via different branches like these to innervate your hand muscles to allow the fine movement of your hands and fingers. Now let us return to our male model, and removing the skin will reveal a lot of muscles like these. And we're going to go over through them location by location. But first, we're going to begin with the upper limb, specifically muscles attached to the scapula. Here I'm highlighting the scapular spine, and you can actually see the upper margin of the scapular spine is associated with the trapezius muscle. And it's called the trapezius muscle because it has that rhomboid trapezius shape, as I'm outlining the muscle right here. And this muscle allows you to raise your arm and allow your chest to pump out to the front. And in these arrows, I'm showing the contraction of the muscle and their corresponding action due to the contraction of the muscles. And I'll be going over the action of the muscles for other muscles. Like this muscle here in this video. This is your classic deltoid muscle. It's associated with the under margin of the scapular spine. And here, as the muscle contracts, you can actually see that you can expect the humerus to actually be abducted away from midline, to be raised up, like you're raising your hand during class to ask questions. Removing these muscles then reveal muscles attached to the scapular surface. And here I'm showing the scapular spine. There's supraspinatus, like as in above the scapular spine. And here's infraspinatus, as in below the scapular spine. And you can actually see that both these muscles and teres minor are attached to the humerus. And underneath the teres minor is the teres major, is being highlighted right here. And these three muscles, supraspinatus, infraspinatus, and teres minor, form the rotator cuff muscles that are often strained easily after a long day of work. And this is the area that I will get my massage done for at the end of the day. Here I'm highlighting the teres major, and in fact, this area associates with the long head of the triceps and the humerus bone. And these four structures, teres minor, teres major, long head of triceps, and humerus, they form this unique anatomical space that I'm about to show here in green. This anatomical space is called the quadrangular space. It has four sides. And medial to it is the triangular space because it has three sides, and underneath all that is the triangular interval, and they both have unique neurovascular structures that travel within. In the quadrangular space, you can actually see the posterior circumflex humeral artery, which is a branch off of the axillary artery to supply blood to the neck of the humerus. And you can also see the axillary nerve traveling with it to supply innervation to the deltoid and the trapezius muscle. Here I'm highlighting the infraspinatus muscle, and removing it reveals the circumflex scapular artery, which can be found deep to the triangular space. Now, if infraspinatus muscle is supplied by the circumflex scapular artery, how about the supraspinatus muscle? Its arterial branch comes from the suprascapular artery, and you can actually see its innervation partner, suprascapular nerve, also traveling with it. But suprascapular nerve supplies innervation to both supraspinatus and infraspinatus, but their arterial branches are different, which can be a little confusing to students. Now let us look at the triangular interval now, and within this space you can actually see the deep brachial artery traveling right into the triceps muscle, and right next to it is the radial nerve. And there is a cutaneous branch of the radial nerve that basically provides sensation, your touch sensation on the back of your arm, as being shown right here. Now let's look at the muscles themselves. Here is your triceps brachii, and that's the lateral head. And there's the long head, and triceps means three heads. So it has three heads. There's a medial head very deep, and then the lateral head that we just saw, and the long head. And now here's the long head of the biceps and the short head of the biceps. And the bicep means two heads. So this one only has two muscle heads. And you can actually see here the musculocutaneous nerve, which is one of the nerves from the brachial plexus that innervates this muscle, as well as other muscles on your arm. And in fact, you can actually see that the musculocutaneous nerve emerges out as it gets sandwiched between the biceps and the brachialis muscle, as being shown, highlighted right here. And in the green lines, I'm showing the bony structures of the upper limb, the humerus and radius. And in blue lines, I'm showing what happens when the triceps get contracted. This actually leads to pulling the radius out back to extend your elbow. And when you contract your biceps brachii muscles, it leads to the radius bone to be pulled up, leading to flexion of your elbow. And brachialis muscle being highlighted here also is involved in flexion of the elbow joint. And here I'm showing that relationship, the sandwich relationship that the musculocutaneous nerve is between the brachialis and the biceps brachii muscle. And as we go more distal down now to the radius and ulna bone structures, there are also a lot of muscles involved in moving your wrist and your fingers. Here is your flexor carpi radialis, and there's extensor carpi radialis longus. And both these muscles are involved in extension and flexion of the wrist. An extension of the wrist occurs when usually you push something against your palm, like when you're doing push-ups. And flexion occurs when you point your wrist down, like you're playing the piano. So in this drawing diagram here, I'm gonna in red line show the contraction of the extensor carpi radialis longus, leading to extension of the wrist, and contraction of the flexor carpi radialis in blue line show the flexion of the wrist. And this is a sagittal or the sideway view. And now this is a coronal view, and I'm highlighting here the extensor carpi radialis longus. Here I'm showing the flexor carpi ulnaris, and here I'm showing flexor carpi radialis. And I'm going to explain the difference between ulnaris and radialis when their name includes those terms. In flexor carpi ulnaris, its contraction will lead to the wrist deviating to the medial side because ulna bone is on the medial side. But for both flexor carpi radialis and extensor carpi radialis longus, their contraction leads to lateral deviation of the wrist. So when there's radialis in the name, lateral deviation, ulnaris, medial deviation. Now let's talk about the muscles involved in the supination and pronation. Here is the supinator muscle buried underneath extensor carpi radialis brevis, as being shown right here. And supination leads to rotation of your forearm like you're holding a bowl of soup. Here I'm highlighting the flexor digitorum profundus, which is involved with the flexion of your fingers, which I'll be going over in this drawing diagram because it's pretty cool how the contraction of this muscle leads to flexion of the fingers. So when you contract this muscle, all the muscles that are attached to the tip of the phalanges also get flexed, and it leads to contraction of these tendons, no muscles, tendons, and it allows you to form a fist. And here I'm highlighting the median nerve traveling right on top of it. And underneath in the deepest part of the forearm is the supinator and the pronator quadratus. And pronator quadratus does the opposite of supination, going from holding a bowl of soup to playing the piano. And now here is the abductor digiti minimi, which allows the medial deviation of the pinky, as I'm highlighting in these red lines here. And abduction means usually away from the midline, and in this case the midline of the hand is located at the 3.5 point of your digits. And the yellow here, I'm showing this little tiny muscle here. What is this muscle? And that's opponent's pollicis. So whenever there's pollicis in the name, it involves the thumb. And opponent's pollicis basically allows your thumb to be pulled out of the plane of the palm, as being demonstrated by these red lines here. And that's basically it. The upper limb has a lot of other muscles and a lot more nerves than what I covered today. But in terms of understanding the basics of how to understand and predict the muscle's action if it contracts, using those red lines, blue line strategies that I went over today. And also remember those key relationships, those key spaces in the upper limb, like the quadrangular space. If you enjoy the content, please leave, like, subscribe, and share with others. Please, we need more subscribers. Thank you and have a good night. Or have a good day. Bye-bye.